Hi, I'm Dr. David Matlock, and what I would like to do is talk to you about our corporate butt, the hottest new thing. Now, I've treated patients from all 50 states and over 70 countries. 46% of our patients are out of state, out of the country. Everyone is coming in requesting our corporate butt. So, first thing, I have over 20 registered trademarks with the United States Patent and Trademark Office. These are just a few. Our most recent one is our registered trademark for our corporate butt. So what is that? What we have found from patients throughout the world, they no longer want this big, huge, gigantic butt. They don't want that anymore. They want something that's nice and natural that fits their frame. They don't want this reaction anymore of saying, wow, did you see that? They want, nice. That's what they want. So our corporate butt is something nice and natural, and it fits the woman's body and her frame and shape. We want the butt to look like a bowl, top to bottom and side to side. That's our corporate butt, not something that's projecting unnaturally from the back, from the sides, something nice and natural. Women throughout the world are coming in and requesting this. So some of the things that I see in the butt, if I use this breast implant, some people, what are some of the most common things that we see? We see that the butt, some women, if this is the top, this is the bottom, they're teardropped. So really in the corporate butt, you may not have that much fat, and we have to focus exactly on what's needed. So this woman needs volume at the upper half. The upper half, she needs volume, the upper half, to build it up and to make it like this. That's what she needs, okay? Some women, and a lot of women that we know, it may be rounded and they may have fullness on this side. Here is the intergluteal crease here. Here's the other buttock here. So we see, okay, it's pretty good here on the inner aspect, the medial aspect, but here it's flattened. That's a common thing that we see. It kind of comes up, but then it flattens off here. Okay, you can kind of imagine that it flattens off here. So then that's what we're focusing on and concentrating on for that particular person. A patient for a corporate butt, they can have volume, okay, also as well, projection as well, plus concentrate on these areas where they are lacking. Okay, so they may have more of a teardrop of a butt. We need to fill top, but also on the side, they may be lacking as well. So we will focus on that. And the other thing that we have to do, we have to sculpt out the most aesthetically pleasing butt. With our Brazilian butt lift, we sculpt out the most aesthetically pleasing butt first, and then it's augmenting the butt. So what do I mean by that? We want the butt to come up and in. We want the butt to come up. Here's the bottom, here's the top, all right, here's the projection. We want it to come up and in. If a patient has all this fat up top, around the back, in the sacral area, okay, that's right in the crease, right up in here above the crease, in the back, the low back, and all this coming around from the sides, from the waist. But if I bring that down in here, then they see the projection of the butt. So we have to really understand the anatomy of the butt and really understand what patients want now. They no longer want this other gigantic butt. If some women want it, it's absolutely fine, absolutely perfect, and we can do that. It's all about preference. But the trend that I see is our corporate butt. Corporate butt. They're in a corporate boardroom, looking nice, looking chic, looking appropriate. So if you need it, call us. You want further information?